Acute arterial occlusion and acute limb. Nope. Acute limb ischemia. Occlusion, sudden disruption of the arterial blood flow that occurs because of. I don't even know why I'm laughing. Thrombus, embolus, tumor, direct trauma to an artery, or unknown factors. I can't finish. All right. Thrombus, when the blockage affects an extremity, blood flow to the muscle is limited. During exercise, muscle contractions may stop blood flow. This process occurs gradually and allowing collateral circulation to develop. If extensive collateral circulation develops, the patient may notice no change or only mild increase in symptoms. Embolus, the most common, oh thank God, it's such a short slide. Most common cause of acute occlusion begin with the heart and travels to the extremities. Conditions that favor the origination of the heart include AF, clot formation in the left ventricular after acute myocardial infarction, a rheumatic or prosthetic heart valve, and left ventricular aneurysm. Arterial emboli can travel to a variety of sites in the body, most commonly lodged in the femoral artery. Most emboli occur in patients with significant underlying heart disease. Left ventricular aneurysm, yep. So clot formation in the left ventricle after an acute myocardial infarction because it's dying in the heart, so it's going towards the exit where most embolus is going to clot and collect. Tumor, direct trauma to an artery, which can be caused by an extreme injury. Diagnostic procedures such as cardiac catheterization, dissecting aneurysm, vasospasm, usually attributable to IV drug use. Blockage in a vascular graft or unknown factors. Ischemia often results whenever there is arterial blood occlusion, suddenly reduces blood flow in the arms, legs. Note the following concerning peripheral arterial disease. The patient experiences intermittent claudication or pain, cramping, muscle tightness, fatigue, or weakness of the legs when walking or during exercise. Symptoms can occur as a result of increased oxygen and demand during activity. Arteries that supply the muscles of the calves, hips, buttocks, and narrowed or blocked by the atherosclerotic plaques that limit blood flow to the tissues. Symptoms that disappear after brief rest and the patient can resume activity until the pain recurs. Assessment includes gathering an accurate history. If symptoms occur suddenly, an embolus is the probable cause. If symptoms occurred gradually, then thrombus is the probable cause. Find out if the patient has ever had a similar episode. Keeping the 5 Ps of acute arterial occlusion, so pain, particularly begins whenever there's distal to the site of obstruction and gradually increases in severity. May decrease in pain, sensory loss progresses, pulseness, pallor, paresthesia, which is signs of life-threatening ischemia, and paralysis, a sign of life-threatening ischemia as well. Finding out whether there is a patient has a risk factor for developing a blood clot, recent extremity injury, IV drug use, heart surgery, or acute myocardial infarction. Could have a clotting disorder, pulmonary embolism, atrial fibrillation, contraceptive use, hormone replacement therapy, rheumatic heart disease, feeling for arterial pulses. We're going to check the brachial, radial, femoral, posterior, tibial, dorsalis, pedis arteries in pair. Pretty much all of the arteries. Document your findings, review the skin and color of the affected limb. The skin of the affected limb usually appears pale, mottled, distal to the or covered area. The foot will turn pale whenever it is raised and very red after 1 minute placing it at a level lower than the heart. Interesting. I think this was a question. This slide's important and I'm just tearing through it. Check for brachial, radial, femoral, posterior, tibial, dorsalis, pedis pairs. I just read that. The foot will turn pale whenever it's raised and very red after 1 minute of placing it at lower than the heart. Skin is affected. The limb may feel cool and may be either moist or dry. Assessing the movement and sensation in all extremities. Checking the heart rate, rhythm, and peripheral pulses. Checking the patient's blood pressure in both arms. Listening to a bruit over the affected vessels or vessel. Watching for signs of chronic limb ischemia, which may be present if the patient has had symptoms or peripheral arterial disease for some time. Management, we're going to allow the patient to assume a position of comfort. If limb ischemia affects a lower extremity, we're going to sit the patient up. And if we place the patient's feet lower than the chest, we want to establish an IV line. We want to establish stand by. Now we're pretty again. Apply the cardiac monitor, apply a pulse oximeter, and administer oxygen if it is indicated. Give medications as instructed by medical direction, including pain medications. Keep the patient compartment of the ambulance warm to avoid cold-induced vasoconstriction of the skin. Transport to a facility of the closest appropriate facility. Reassess the patient's condition frequently en route. Monitor the 5 Ps. If the patient refuses care, repeatedly urge him to accept your assistance, including the transport. Consider contacting medical direction for advice. Document the patient's refusal, or just wait for them to pass out and have a single episode right there. Acute deep vein thrombosis, DVT. Thrombophlebitis, the development of a blood clot in an inflamed or damaged vein. Superficial thrombophlebitis occurs whenever a clot develops into a vein near the surface of the skin. DVT is present if a clot develops in a deep vein of the extremities, associated with increased risk of pulmonary embolism. I think this was a question. 3 important factors that develop in a thrombus. You have venous stasis, sluggish blood flow, patients who are pregnant, immobile for long periods, and those with obesity or heart failure. Damage to the inner lining of the blood vessel caused by trauma, inflammation, venipuncture, or the actions of agents given during IV therapy. Blood clotting disorders caused by dehydration, certain types of cancer, and cause oral contraceptive or hormone replacement therapy. Assessment, so patients with DVT may seek medical care because of pain, swelling, tenderness in the limb. Find out if they have risk factors for DVT. We're almost there. We are almost there. Carefully assess the patient's upper and lower extremities. Compare the extremities in pairs. Look for signs of inflammation of the skin over the affected vein. Look for the pain and tenderness of the calf muscle on the dorsiflexion of the foot, Hammond sign. Be careful not to rub or massage the affected limb. Could dislodge a clot and cause a thromboembolism. So handle with care. Pre-hospital care is mainly supportive. Allow the patient to assume a position of comfort, establish an IV line, and apply the cardiac monitor. Apply a pulse oximeter and administer oxygen if indicated. Monitor the patient closely to develop for the development of a pulmonary embolism. Transport without lights or sirens. Interesting. If patient refuses care, repeatedly urge him or her to accept you to without lights or siren. I guess we don't want to upset them, maybe. Consider contacting medical direction for advice. Document patient's refusal. That's all she wrote.